Good afternoon and welcome to patients who are with us today from different places in the world at this patient forum within the framework of the celebration of the first international conference on DAO deficit. It was a very interesting day with scientific presentations. We had representatives from the scientific and medical and clinical community from different parts of the world. This patient forum, as its name goes, it's only dedicated to patients, and it is led by the team of nutritionists and psychologists of the dietists, and we will count on the participation of Judit Rigau, a clinical nutritionist, Gemma Peralta as a clinical psychologist, and Adriana Duelo, who's also a nutritionist. So we're going to start with an initial step of the forum entitled How to Follow a Low Histamine Diet, which will be presented by Judit Rigau. She's an MA in physical activity and sports, and right now she's specializing in the treatment of DAO deficit. I'm going to share my presentation. So, well, thanks very much, Anna, for your introduction. And I'd like to start this block with one simple question, which you are with us today, listening to us, you've already questioned that. But do you have a DAO deficit? Probably it sounds as double Dutch to you, but as a clinical nutritionist, I can tell you that many of my patients have already got quite a bit of information, either because they have read or have been visiting several doctors. But if you're here today, I want you to be attentive and let me ask you a few questions. Do you usually suffer from headaches? Have you had any episode of migraine? Is your belly swollen? Do you go regularly to the bathroom? Or maybe your stools are very liquid? Or have you had that feeling of reflux, acidity coming up? Maybe you've got redness on the skin, or you suffer from dermatitis or atopic skin. As I'm questioning, you may see that symptoms are very diverse. There are some of them which have nothing to do with the other. Do you usually suffer from muscle blocks? You feel suffering from numbing of hands or feet? Do you feel full of energy or lacking it? And finally, do you suffer from rhinitis? Do you sneeze frequently? If you have answered yes to more than 2 symptoms, maybe we can be facing a DAO enzyme deficit. And what is it about? As its name stands for, it is a lack of these enzymes, the diaminoxidase. The DAO, as is the case of other enzymes, of most enzymes in our body, is to be found in the small intestine, and they are like the gate of all nutrients. When our body cannot produce or create these enzymes in an adequate fashion, what happens is that histamine is accumulated in the bloodstream. Let's show it in a different fashion. Do not worry about this complicated diagram. Histamine, when it's eaten, it is eliminated through urine, but when this DAO enzyme is not working, it is not metabolized, so we cannot eliminate it. And what happens is that it becomes accumulated in the bloodstream. When there's such an accumulation of histamines, then we have a cascade of the symptoms I've mentioned. And in fact, the most common one, or the one posted as one of the most difficult because deficit, is a migraine. But there's no need for you to have migraine in order to be suffering from this deficit. And in fact, we're going to visit patients with migraines, with urticaria and fibromyalgia. There's no specific requirement of specific symptoms for this deficit to be diagnosed, but rather the accumulation of symptoms. A combination of symptoms will be indistinct, so every person will have a different set of symptoms. We have patients with migraine, and maybe a brother or the mother has got a different symptom. So when doing a diagnosis, you should not discard a DAO enzyme deficit if you've got symptoms different or similar to those of one of your relatives. We've said that histamine becomes accumulated, and that leads to the occurrence of symptoms. And where would this histamine coming from? The accumulation of histamine comes by the hand of the accumulation of foodstuffs with a big contents of histamine. So that's why it's so difficult to relate the use of a certain foodstuff with the accumulation of histamine. But let's highlight 3 elements that we can come across with such accumulation. The first group would be deterioration processes. There are some foodstuffs such as meat, fish, which during its deterioration accumulate histamines, and this would be the most common form, which would be the poisoning through histamine. Then foodstuffs which have it naturally, and then because of the use of fermented products such as cheese or alcoholic beverages. And with all these questions, you may have a suspicion of suffering from this deficit. And who do you resort to? The diagnosis should be made by a doctor or a specialized nutritionist. Today at this forum, we're going to explain which are the tools we have available for the diagnosis to be made. Then Diana will make a short summary of the tests which are available today for the diagnosis. And depending on the results obtained from the diagnosis, a different treatment can be applied. But our basis as a treatment will be to follow a low histamine diet, very strict diet, for at least 4 weeks. And from then on, a steady reintroduction is made depending on the patient evolution. And the first thing everyone does is to look through the internet. When you are suspicious of this deficit, the first thing you do is find out what you've got to do. And the problem with the internet is that the possibility for you to do a very limited diet for a long time. And so if you are suspicious of these, please resort to a nutritionist which can do prepare a diet specially adapted for you. Another we apply is supplementation of the enzyme, and the dosing will be different depending on the person. And to finish, I would like to say that the type of person we come across are the The clinic is different. The variety of symptoms, maybe at the beginning there's no linking element, so the patient can feel lost because has resorted to very many different doctors of different fields, and in the end they do not know what they are suffering from, so they are disappointed. And it is indispensable to do a multidisciplinary job, because you should not treat one single factor. You should be treating all elements affecting symptoms. And among all professionals working there, I would highlight the role of allergologists, internal medicine doctors, GI doctors, and the role of the psychologist, out of what was mentioned before, because they're a type of patient which are disappointed, which feel lost, and that's why the psychologist will be speaking to you about the follow-up then with patients with a DAO deficit, and how important it is to count on a good emotional support. This is all on my side. Thanks very much for having listened to us, and I hope it's been interesting for you. Thank you, Judit, for your presentation. It's very important for patients to identify if they are really suffering from DAO deficit, or at least there could be a suspicion of it. As you said, the role of the psychologist is important in terms of accompanying patients with a DAO deficit. Every patient is a special case which should be dealt with in an individualized fashion. And that's why Gemma is here, in order to speak to us on how to live together with the DAO deficit. She is got an MA in behavioral medicine and psychological intervention. Thanks, Gemma, for being with us here. Thanks very much to you all and the organizers for having invited me, and all listeners. And I'm going to share my screen with you, and I'll tell you what I can show you during this time. It was upside down. Sorry about that. Okay, so what is that we're going to be dealing with? The psychological approach, which is the approach we start from when we work on DAO, which is the type of thinking we assess. What's the point of an intervention on emotions? What should we take into account when we do behavioral intervention? So we will be dealing with these three aspects: thoughts, emotions, and behavior. The global approach of the chronic disease is especially supported on these components of the culture of the person. We must know the social and cultural environment of the person when proposing changes, especially at the level of the data level. Work from the field of medicine, count on knowledge on the treatment, pedagogic aspects and psychological aspects, so we can act on the intervention, so the person can introduce behavioral changes. And why should we refer to psychological approach? This author defended that any proposal for change should take into account biological factors, emotional factors, and social and cultural factors. And if these aspects are not dealt with, the possibility for such changes not to take place is true. It becomes a reality. And we psychologists dealing with digestive intervention, and from the point of view of the psychology of health, which is the one approaching problems having to do with disorders and diseases, and health care psychology is supported on the cognitive behavioral theory. And this theory postulates that thinking, emotion, and behavior are interrelated. It's like some 25 years that psychologists have been saying what is coming before the egg or the hen, the emotion prior to behavior, etc. And what we know is that these three areas are interconnected. So we have behaviors. These behaviors can give rise to emotions, and such emotions have an influence on behavior. And when we speak about emotions, we ask the person how he or she is feeling, and when we ask them on their thoughts and we take into account fears, we're approaching the area of thinking. And with regards to behavior, that's where the clinician sees if there's a certain fear. And with regards to behavior, we analyze if the dietary pattern is being respected. And when we see that with regards to behavior, there are problems that the person does not establish changes, and the changes stated here are not carried out, it is very important to work on these two areas, on thought and emotion. Let's approach each of them. And with regards to thinking, which are the thoughts which are evaluated, especially in patients at the clinic? We analyze how the diagnosis was lived. It's people who usually travel from one visit to the next, down to the point in which the diagnosis is achieved. Also, the vital moment is identified. Is not the same. Looking for that or researching into that with a person who's just starting their life, if they leave it as a danger or as a gain or as a loss. And when we ask about thoughts, we ask them, why do they think it is limited? When we work on thoughts, if this example of the painting of the shriek, which is what is known, the interpretation of this painting was done without any idea on what the author thought when he painted it. But not so long ago, 4 or 5 years ago, it was discovered an engraving where the author wrote what he was thinking with regards the painting. So he wrote, I listened to a strong sound crossing nature. And here the painter highlighted what he thought of his work. I listened to a strong noise crossing nature. But the interpretation which was given to the painting was anguish, and anxiety, something which has nothing to do with what the author thought. So the current interpretation of the painting is that the author did not want to represent a personal act, but the general feeling of contact between man and nature as terror against external noises. So when we have a DAO deficit patient, we should get as deep as possible into thoughts. And what is it that we're acting on, especially if we believe that there are mistaken beliefs, or maybe certain information was obtained leading to negative thoughts that the person will not be able to get out of these symptoms, etc. When we detect that the person feels constantly insecure, and because of this feeling is losing quality of life, and especially when we observe that the person confronts these illness in a passive way. I'd like to specify that most patients I see at the clinic, when they get an improvement during the first stage and when the symptoms have diminished, many of them prefer not to change stages in order not to get out of that momentary improvement. So they are doing a passive confrontation and not assuming the changes coming afterwards. And that's when we have to intervene psychologically, so we help them change stages. So in terms of emotions, how do we act and what is that we work on when we do an emotional intervention? We see that the emotions of a person with a disease can minimize or promote learning. In any chronic disease, learning is something which is always impacting the person. So any disease carries emotions about. And what is that we do when we intervene, especially helping them around these three aspects? The identification of the emotion. Many patients at the clinic, they know they are feeling unwell, but they do not know what they are going through, and we've got to dedicate some sessions to intervention, because patients are feeling sadness, and then patients which identify that what they are feeling is anxiety or anguish, and we've got to help them regulate these emotions so they are not an obstacle in terms of the adaptation to treatment. So we adapt these so they can become adapted to treatment the best way possible. And the emotions we usually ask on is how they're going through the situation, how it affects their day-to-day activities, which are their emotions. We help them identifying the emotions, and especially the causes of the moments at which these emotions take place, especially for them to confront social situations when they feel a certain level of anxiety or sadness. And with regards to behavior, is the point at which the clinician assesses the treatment compliance. And when it is not taking place, we've got to investigate in emotions and thoughts. And what is that we do at the behavioral level? We assess if the person with a DAO deficit before the disorder is a systematic person, structured person, or a chaotic person with no pre-established habits in terms of eating or in general terms. We ask them how they deal with eating, because with people who are more anarchic, we'll have to establish order patterns in order for them to follow the treatment. And we also question if they have other habits. For example, if they are clean, they have the timings, for example, with regards to the labor environment. This is usually better prognosed than the case of people who follow the spontaneous will. And at the behavioral level, we're also interested in observing how is the narrative. It is focused on action or induction, especially to assess confrontation. And last, with regards to context of the environment, do you believe that people with a DAO deficiency are supported by the family? I would say, considering the patients I've been dealing with, that support is not there. Maybe because it's not yet a known disorder, but mostly patients complain that their family and social environment do not support them very much, even if they have been diagnosed. And this leads us on to thinking of group interventions also in the family in order to help them clarify what is all that about and the steps that the person must take in their day-to-day. So also we ask them on the role they have with the family, if they are passive or active, as in the terms of the functioning in the family. To finish, I would like to give you these 5 keys. It's important that patients are giving information on the disease and information which is true, and that we review the thoughts they have on the disease. We've got to help them in the identification of emotions and the management. The perspective on the disorder should be readjusted so they have clear in mind the steps they have got to follow. The behavior they develop should also be reviewed, and especially a level of support in their family should be achieved so they can flee isolation. I met many patients who, with all their symptoms and problems, they became isolated from the environment, and their social behavior is impaired, something which in turn influences in the conditioning of the mood. That's all on my side. Thanks very much. Thank you, Gemma, for your participation. It's a very interesting subject, the DAO deficit. And it includes elements which sometimes the patient enters the uncomfort zone and doesn't know how to deal with the day-to-day symptoms. So thanks very much for your work with these patients. And one issue is if the DAO deficit can be healed. Adriana Duelo. He's got more than 10 years of experience in the field. And right now, she's specialist in amines and polyamines and a member of the International Association for the DAO deficit. Thanks very much, Anna. We start this last speech so we can have time enough at the end so we can listen to questions and answers. So this is one of the questions which are made at the very beginning of the disease. Can this be healed? What is going to be my evolution like? And in the end, the response is never yes or no. Our response is it depends. So it will depend on the source of this DAO deficit, which is mainly due to a genetic origin. We're about to finish the first paper for my doctoral thesis, and I can tell you that around 80% of patients with DAO deficit have a polymorphism of one of the variants, and it would be the main source of this metabolic disorder. And without a metabolic deficit, it will not be located. So it should be made clear that the patient is going to control symptoms after so many years, and maybe for the first time, is going to take the reins of the control of their symptoms. So it's not so much if it's going to heal or not. And that's a good thing of our work. Of course, there are acquired cases which can also generate DAO deficit, and some of these factors may be modified. So maybe in such cases there could be a transformation or reaching an increase of these enzymes by modifying these factors, such as, for example, by the hand of the doctor, replacing some of the drugs that the patient is using, and maybe that drugs are blocking the DAO enzyme. They cannot always be changed or modified, but there are more than 50 drugs which have been described as blocking DAO. And then there's the fact that today wine is accepted, and wine is got alcohol, and such alcohol, the ethanol, generates a block of the DAO enzyme. And we've seen how withdrawing double fermenting drinks, part of the DAO activity can be recovered. And the third factor would be GI pathologies, especially intestinal inflammatory diseases such as colitis or Crohn's disease. And they become specific because they generate the villi of the mucus, so the DAO, as is there, the duodenum, could be seen with a reduced level of activity. And in the case of improving these pathologies, that could be also an improve of dioxin oxidase. Also in the case of dysbiosis, there are bacteria that we know, which are histamine producers, and this histamine could lead to an inflammation of the small intestine. And this would lead to a deficit in the DAO enzyme. And finally, hyperpermeability or enhanced intestinal permeability would lead on the one side to an increase of the absorption of histamines, or on the other hand, generate an inflammation of the mucus itself, and inflammation would in turn generate this DAO deficit. So that's where a certain level of activity could be recovered. And in the case of a resection or a cut of the bowel, it would have an acquired origin, but there would be no possible recovery. And how can we diagnose genetically origin DAO deficit? In fact, it's a test which can be done at home, or even with patients which who do not live close by, and we send them a kit to their homes. It's a zero-invasive test, very fast one. In just a few days, you get the results. So it is a simple test. We recommend it for patients that we see a clear family pattern, where there could be a precedent of symptoms related to the DAO deficit. It's important to highlight that what's most vital, well, there's no need for the same symptom to be inherited, but there must be differing symptoms, because what's generated is the deficiency itself, the variance, genetic variance of a father or a mother. So that's why it's so important to ask for the history in the family, even if the patient has not thought of that. Because if they have migraine, maybe the parents do not have migraine, but they suffer from GI problems. So that's why it's vital to ask about it. In this slide, you may see an example, a true example of a patient, and the 4 variants of the DAO gene were analyzed, and in this case, the 4 variants were in disorder, and the acquired origin, for which a certain recovery could happen. We see how these villi in the intestine, which make it possible to absorb food, the DAO is there. So when there's an irritation or inflammation of the mucus, these villi become shortened, and everything living there or coexisting there, to a certain extent, becomes unbalanced, and the DAO enzyme would be affected under the presence of inflammation. So in that case, we should try and recover this mucus and try and grow these villi, and also accompanied by other dietary supplements. As I was saying, one of the elements we see that are affected in the last few years would be this imbalance of the microbiotes that we have seen. More and more patients who are suffering from a DAO deficit without dysbiosis. So we've got to work on both sides with a low histamine diet, supplementation of the DAO enzyme, but also reducing inflammation of the bowel, and balance the microbiota of these patients by reducing the bacteria which produce histamine, because they are going to create these deficiencies, these DAO deficiency. And this would be an example of analysis of DAO activity in blood plasma. It's an type of analysis that we use as an adjuvant analytics to the whole of the diagnosis. We do not use it as a single tool. Only, well, 10 years ago, it was the only tool we had. But today, we have found many deficiencies because with regards to metabolism, during menstruation, for example, it changes a lot. So we've got to be very precise in terms of when do we ask for it. And it can also be influenced by the use of drugs, alcoholic beverages, or some type of change at the plasma level. Let's not forget that this analysis, which is carried out on plasma, and we should rather find about the intestinal DAO, and an intestinal biopsy cannot be analyzed as of today. So it's the only test we can have in order to correlate the activity of plasma DAO. But there's no single analytic diagnosis. So we've got to draw a history and look into other parameters so we can reach an adequate conclusion. As I mentioned, the treatment is going to depend on the origin. We're going to be based on a low histamine diet and low in other histamines, which can let us to accumulate histamines in an orderly fashion. We can think of, for example, the amines to be found in citrus fruits. Also, we should avoid foodstuffs which are histamine releasing, for example, milk, foodstuff, seafoods, and ethanol. We've already referred to alcohol. should also be limited. And second, we widen the treatment with supplementation because it is impossible to use a diet, a histamine-free diet. So you've got to use the DAO enzyme, especially at the beginning of the treatment during the first and second stages. And in specific cases, we can use other supplements such as probiotics, quercetin, omega-3, such as blue meat fish. Also, we're working on fungal extracts, which can benefit intestinal permeability. So we see that a treatment is basically it's a set of a very well done and designed diet made by a nutritionist and dietist with a very specific supplementation for each specific case. And now we will look into the questions we have generated among the audience, because we've been left some minutes. We've got almost 20 minutes for questions, so I won't say anything else, and we will now start the question time. Thanks, Adriana, for your participation. A very interesting information for all patients. Many questions have been generated. I tried to group them for each of you, but we'll start with this section on the psychological treatment. A patient is asking, or is asking you, Gemma, how can you start? A key hint so these persons can improve their quality of life in case of a DAO deficit. We should take into account what is it that they stop doing because of symptoms, and not all people become motivated with the same triggering factors. So what we should do would be measure what would an adequate quality of life be, and according to that we should be working on the emotional side, because if the person fears confronting that the situations which are feared by the person should be put in context, and in case the person is at stage 1, which is more limiting in terms of the control of foodstuffs, how can we work on some social variables which will let the person to gain contact again with the social environment in a gradual fashion? So that would be my starting point. Perfect, thanks very much. There's another question. Do you know the average treatment time so that can be planned? The average time for a psychological treatment, I wouldn't dare say, but psychologists working on health psychology and acting on diseases, we've got to manage to bring the people onto an emotional improvement, but also that they become treatment compliant and confrontational with their way of living. From my experience, I must say that during the first 2 months, assessment, treatment, and dealing with thinking and emotions would be the first stage, and on the second month, we would act on the active confrontation of situations. So when at most 9 to 10 months have passed, a certain quality of life may be established. So now in the field of nutrition, maybe it's a question which can be answered by Judit. Why symptoms related to DAO deficit are increased with the passing of time? Well, I wouldn't say that. I wouldn't express it that way. What is that changes with time? That could be a hormonal change, or as Adriana says, maybe we've been having a certain drug. There are more studies related to these type of changes, or stress, for example, is also very important, and not directly with the reduction of the activity with age. So we're talking about factors which are become additional with the passing of time. Okay, become accumulated. What's the relationship between asthma and DAO deficit? Asthma would be one of the symptoms that you can have as caused by the DAO deficit, and it would fit into the group of respiratory problems, but the type of symptoms DAO patients suffer from is very similar to an allergy. So the typical symptoms of an allergy, for example, flatulence, distension, it would be rather a variety covering many more symptoms, and which would be similar to an allergy. So then, beyond current symptoms a patient might have, and in the long run, can a patient suffer from other consequences in their health? This is related to the question before. So, yeah, the bigger number of symptoms, and more things that can happen to you with time. So it can have an influence on you if you truly, if what you do not do is a low histamine diet and you still take histamines, you're going to get more symptoms. For example, if you've got esophageal reflux, that acidity is going to burn your esophagus, and that can lead to a complication. Okay. And one last question having to do with foodstuffs. For example, pumpkin and meat. Where could we locate them? Can they be used? Well, we didn't want to speak of specific foodstuffs right now because we had a short time, and I just wanted to give 3 hints on foods which could have a high content in histamine. As Miriam said, a zero histamine diet is almost impossible. When there's a deficit, when histamine is accumulated, unless there's a poisoning. In the case of meat or fish, it's really easy to be poisoned if it's in bad shape, but you can eat meat if adequately prepared, and pumpkin would fit into the second group, which are naturally laden with histamines, as it would be the case of tomato. Yeah, I think we have time for an additional question. A patient tells us that some 6 months ago is doing a stage 1 diet with a little physical activity, and that leads on to the symptoms. Can she use histamines or not? I think it's an important case. Well, there would be some drugs here which can be blockers of the DAO enzyme. If it's eventual use, it's okay, but if it's an regular use, we would have to try and reduce them, but of course following the doctor's patterns, because in the end there can be a blocking of the DAO enzyme. But everything should be taken as a whole. If the person is being supplemented, if the patient is compliant with the diet, so I would encourage the patient to follow, to be subject to an adequate follow-up, and when practicing exercise, which is one of the other things we mentioned, it's also and there's usually more symptoms. So it is a question of controlling each factor and assessing if there's the need to follow a more restrictive diet or rather make improvements and withdraw and remove supplements. Then we've got a question more addressed to Adriana Duelo. So from when can tests be done in a child so DAO deficit can be diagnosed? Adriana is not specifying the age. And also, well, the genetic test, which is done through a scraping of the mouth mucus. It can be done before 1 year of age, because earlier than that, after 1 year of age, because unless the factors are very evident, that would be difficult. So I would say 1 year. And in the case of plasma analytics, it is true that a 1-year-old baby injecting anything, it's well, maybe it's too much, but the genetics is and in the case genetics the result is negative, a plasma test can be analyzed and amine oxidase after 1 year of age.
Otra pregunta. ¿Se puede utilizar el extracto de riñón utilizado como fuente de DAO? ¿A nivel de suplementación o
So, can kidney extract, lyophilized kidney extract, can be used as a supplement and as a source of the DAO? It is not said if it is the powder or, but we've come across cases which could be similar to kidney extract. For example, the Poses extract. If we use kidney extract with no coverage or pea extract, as Dr. Comas was mentioning in the morning, that they have found DAO activity, but with no gastroenteric coverage, once it reaches the stomach, our acids prevent any DAO activity from happening. So it wouldn't be advisable because we would be wasting our money. So using the extract is not viable. Yeah, without any kind of coverage, it would be senseless. And if we speak about a DAO source, there's a question with regard to supplements in the market. Nature DAO or DAOsin, what is that the patient should be looking into? First, we've got to split them into two. First, we have the animal sources, DAOsin and DAO food, and then a vegetable source, which would be nature DAO. As of today, scientific evidence tells us that the most, the safer ones are the ones with an animal origin, and the ones working with intolerance to histamine. So as a professional, I would go for those with an animal origin. But there's also a study done at the University of Barcelona comparing all these supplements, the current supplements in the market, and the ones with the biggest level of activity would be the animal sources in terms of what's available in the market. So I would discard for the second time the vegetable sources available in the market. And with regards to the two you mentioned, I would use the current one, which would be the DAO food. So you've got to look into the activity of the product and also what you mentioned before, the coverage, the GI coverage they produce. Usually you find it in the label, isn't it? Yeah. It's linked to the question we had at the beginning. One thing is having an extract, and the other thing is that is well covered. I believe, and I don't know if I'm saying it adequately. I believe that DAO food is the one with the best GI cover. So it reaches the small bowel almost intact, in an intact form. There was one last question. I think this person came perhaps a bit later on into the conference. The origin of the DAO deficit, it can be inherited. Well, we mentioned it at the beginning, and I could say I never said it at an earlier presentation because something very new that I'm looking into through my doctoral thesis, and I can tell you about a recent result. About 80% of cases are due to genetics, genetic load. So it would be the main cause for such deficit. Okay. We have run out of time, and most of the questions were linked to each other. So that's why I grouped them. Thanks very much, Gemma, Judit, and Adriana, for your participation and for your commitment towards science, and your bringing confidence to our patients. We hope we have been of help for our patients, and for any other check and any other question, we have regular communication channels. Thanks very much, and good afternoon. And thanks very much for having invited us to be here today. And all patients, I would encourage you, in case you've got any questions, we will be happy to help you. You can find us in social networks through email and phone. So here we are. Thanks very much, and see you some other time. Thank you.